Hello, this is David from DN Cognitive Counseling. It seems like I'm never going to be able to get out of the masks. There's a lot of still misconceptions and different ideas, and it's a very emotional issue for a lot of people for a lot of different reasons. And again, I'm trying to bring you the facts about what's going on so that you understand both sides and both positions. Tonight, I'm going to respond to Jennifer's comments, who spoke very strongly about the last video I did on, of course, should children be back in schools, and whether or not this is how political it's gotten. So I'm just going to go straight into this with Jennifer's comments. Jennifer says, "You've mentioned here in the previous video that children were unaffected. When I brought up a secondary inflammatory disease, you said their numbers were unremarkable. Here is the link indicated the inflammatory disease is still a significant issue. Although the numbers are small to me, the same concept applies to this as to COVID. There is no acceptable percentage of children suffering and or dying." And I'm going to go through your article in a minute, Jen. But I have to say that your premise, by that logic, is you shall never send your children outside of your house ever again. Because every time you send your children outside the house, there is a percentage of something bad could happen. They can get a disease, they could be hit by a car, they could have child abduction. You would never be able to do anything if you're going to use the term that although the numbers are small, the same concept applies. There is no acceptable percentage of children suffering and or dying. If COVID had the same contagion rate and death rate of the flu, we would not be shut down right now. There'd be people dying, but it'd be much smaller numbers. We wouldn't hit the 100,000s, and we wouldn't be closing up as much as we are. The reason why we're closing is because it's not like the flu, because it is higher contagion rate, because of the fact that it kills more people. And that's why you're seeing, even in states like Texas and Florida, and even the President of the United States now has to pull back on certain things that he wants to do because he recognizes the science. Again, science doesn't care about your feelings. You can't determine what you like just because you like it to be a certain way. But on the same token, we do work on the premise of the actual numbers and what they do. So again, I wrote back, of course, you can never send your children to school or get other things due to the flu. It kills every year. The flu is especially bad for children, according to the CDC. The latest CDC reports 92 pediatric deaths have been reported as of February 2020. And of course, Jen says, I need to remember how frustrating literal you are. I mean, there's no acceptable percentage when there are alternatives that can help prevent something. We could die in a car accident, but we must be wearing seatbelts to minimize the risk. You said yourself, if the contagion rate that makes the virus so threatening. So in my opinion, all precautions should take to minimize the risk. And if it's determined that the risk to kids is outweighed by some other benefit, then so be it. But it shouldn't be owned and not disregarded as if there is no risk. And Jen, I 1,000,000% agree with you on this. And this is where I think where the first comment contradicts the second one, because in the first one it sounded like you were saying there were no risks. So I'm glad that in conversation you're able to clarify the point. And that's exactly what we have to get to. The idea is we have to understand what are the risks on both sides, which is the reason why I'm not sitting here and saying this is what we should do. I think that this is much more complex. I don't know what the absolute benefit and or risk is going to be, and not only for the children, but for society at large. So I think it's very important, and just because I want to respond, just in my humble opinion, but snarkiness is never an appropriate response to anything, nor does it usually result in anything positive or helpful. Again, I'm going to disagree with you. I think snarkiness sometimes can. I've used it many times in my groups, and it's been very effective. It doesn't have to be mean, and it doesn't have to be in bad taste, and it doesn't have to be hurtful. I think that's very different. But I think at times to make a snarky remark that makes a point without being mean is I think appropriate, and I think brings color to life. And that's why I wrote, well, I don't always agree. To which you go on and say, I love, she says sarcastically, that everyone's concern is how many people are dying. I'm a cancer patient, and I had the flu for the first time this past January. I never experienced anything more awful awful. In my opinion, my family and I had COVID, but there were no tests at the time, at that point in time. Regardless, I suffered for 2 weeks. My husband suffered for 6. If anyone does the math between how many infected, how many recovered, how many died, there's a significant number missing because those people are still in the hospital and they're getting treatment recovering. This disease sucks. Whether it kills you or not, it causes a great deal of suffering that nobody should have to go through if it could be prevented. The fact there are so many cavalierly saying children won't die is okay so we expose them infuriates me. As a mother, it's heartbreaking to watch my children sick. So for some selfish, irresponsible people to infect my children because they see a mask as some infringement on their right of government control, to me is unacceptable. There have been studies done that indicate there are irreparable damages this virus can do to the human body, and it can cause a secondary inflammatory condition in children, which not only can be deadly but can be quite severe. We're still learning things in regard to the caveat virus in regards to the second inflammatory condition. So in my opinion, it's premature. I don't think I'm responsible for anyone to claim anything definitively. I hate that this become a political issue instead of a medical one. To me, it's also unacceptable. No one likes the quarantine. No one likes the mask, but I promise you like the virus even less. As far as the percentage that die, are your viewers willing to sacrifice one of their relatives? Because I'm not. I do understand the infuriation in regard to the double standard and the hypocrisy, but it does change the fact that wearing masks prevents the spread of the virus. And the same question that the mother used to ask me when I was young, would you jump off a bridge just because your friends did? Just because some people are responsible, ignorant, in my opinion selfish and stupid, doesn't mean you should be also. And again, Jen, in terms of mask wearing, I'm in total agreement. Absolutely. In terms of the school and the questions about it, we are still at a point where there's so much that we don't know. By opening the schools, we're going to see what will happen. I personally would love to have seen some sort of pilot aspect of opening in some certain places to see whether or not, and then do it slowly to see whether we get an effect or not. But it seems to be that nobody's doing this with any sense, and it's become very political, which I think is very scary. Because if you are politically right here or wrong, it's going to be in people's lives. So this was the article that Jen sent to us, which was from the University of Minnesota, and worrisome details noted in kids with COVID and inflammatory syndrome. And this is on June 29th, 2020, so it's relatively new. And this comes from the New England Journal of Medicine, published in 2 studies spotlighting the serious manifestations of COVID-19 related multi-system inflammatory system in children. The first involving 186 kids in 26 states, and the second involving 99 patients in New York. So on May 14th, the Center for Disease Control and Prevention issued a National Health Advisory on COVID-19 patients and features the MISC similar to Kawasaki disease, a rare pediatric inflammatory disease that can cause coronary artery aneurysms and toxic shock syndrome. Both studies reveal the same high level of intensive care, 80%. In the first study, a CDC-led team conducting retrospective and prospective surveillance of U.S. pediatric healthcare from March 15th to May 20th found that 135 of 186 children, 73%, with the MICS had previously been healthy. 55 of the 137, 30%, who tested positive, had known exposure to a person with novel coronavirus. So what they're saying is that of these 73% of these kids, they have been healthy and they don't know the cause. 30% had been tested positive for COVID. Of the 14 patients who reported COVID symptoms before the MIC was identified, the median time for coronavirus symptoms onset of the MIC symptoms was 25 days, so from 6 to 51 days. The median patient age was 8.3 years. With 115 patients, 62% were boys, 57%, 186 of the 131% were Hispanic and Latino, 31% were Hispanic and Latino, and 25% were black, 19% were white, 22% were unknown race, and 9% to 5% were other race or non-Hispanic. Of the 186 patients, 132 had involvement in at least 4 organ systems. Organ systems involved including the gastrointestinal system in 171 of the 186 patients, the cardiovascular system in 149, the hematologic system in 142, the tenacious system in 137, and the respiratory system in 131. Again, the median hospital stay was 7 days, 148 needed to intensive care, 90 needed medication to regulate their blood pressure, and 37 required mechanical ventilations needed for non-invasive mechanical ventilation, and 8 needed their blood oxygenated outside their body. 15 patients had coronary artery aneurysms, and 40% had characteristics similar to that of Kawasaki's disease. Of the 186, had elevated levels of at least 4 inflammatory biomarkers. Of the 4 children who died, 2 had underlying conditions, 3 needed their blood oxygen outside the body. All were 10 to 16 years old. That's the point here. And this is what they're actually talking about here. Of the 186 patients that went through this, and again, none of this is wonderful, 4 died. And that's, by the way, in the entire United States. Outside the United States, they didn't even find this outside. So again, and I understand the idea that you don't want your child to be one of the 4. I totally get it. But this reminds me of the old aspect of Fight Club. And it was something that reminds me of this aspect that we all have to remember, that there's a reality to in this, that you understand that when a recall takes place or something takes place and happens this way, the reason why this is the case is because there is a formula put to it. And it may sound cold, but this is how things work. This is from June 18th of 2020. How likely are kids to get COVID-19? Scientists see a huge puzzle without easy answers. So the beginning part of the article, it became clear that the new coronavirus was transmitting with ease among people in China. One of the top questions scientists were studying was disease dynamics. One of the answers was this: what role are children playing in the spread of the new disease, now known as COVID-19? 5 months later, there is still, the rest of us would still like to know. There is some evidence that kids are less likely to catch the virus, less likely to spread it, but it's not clear exactly how strong the evidence is. And this is why I said I don't know, because this is what the facts are. We're not sure. Much of it was generated at the time when the children were caught up in the topsy-turvy world of COVID-19 transmission suppression, which schools closed and families cocooned, limiting their chances of catching or spreading SARS-CoV-2 virus. In reality, it takes reopening schools and returning children to closer to normal life for the picture to come into clearer focus. Now, this is what's scary about this, is that we're going to have to be able to see what happened somewhere along the line to find out at some point of whether or not children are based upon this. Now, there are certain places where schools did stay open in the Netherlands and places like that, and they've been found that the children did not contract it, which is why that people are saying these things. Now, again, people are making this a political issue, and I love, at least, the fact that there is a voice of reason out there on the right who actually is putting at least an honest face to this and what I've been trying to say. And I'd like to be able to do that right now by looking at Ben Shapiro talking to David Rubin specifically about this issue.
Let's just do COVID quickly.
Sure.
Like, where the hell are we at in this? Let's just talk about California for a second. I mean, we just in the last couple of days went into another freaking lockdown. It's beautiful outside. I'm not sure what the beach situation is, whether we can go there, but I know I can't go to a restaurant. It's like, what the hell is going on here at this point? What do you think is honestly happening at this point?
So I think what's honestly happening is that you have a deadly disease that has probably somewhere between a 2 times and 6 times deadly as an effect as the flu.
I just want to say Ben Shapiro here is guessing between 2 and 6 based upon these different numbers and different factors and projecting. So that number is not statistically correct between 2 to 6, but he's saying somewhere between there.
It's somewhere between 0.2 and 0.6 infection fatality rate. And that's dangerous, and it's very, very infectious. And all of that is true. The whole point of flattening the curve was to prevent the overwhelming of the healthcare system. We are not seeing the healthcare system being overwhelmed right now. And so the idea that the only tactic that is available is full-scale lockdown, I think, is not backed by evidence. I am also growing extraordinarily tired of people shouting that they are on the side of science while variously changing their opinion literally every 15 seconds.
Well, this is the problem with science, and the fact is the reason why the opinions are changing is because, like all things in science, the evidence comes in and then you start to see different things. So it's a little bit disingenuous to criticize people who are saying that, because they were doing it based upon the science they understood at the time. And it changed. Now, I will say I was out and ahead of a lot of this, again, because of what I was seeing, and basically, based upon my experience with other diseases in the past and the protocols we used, and I saw what was going on. And I said, these again, using deductive reasoning, not scientific principles. And again, with science, they don't care about deductive reasoning. They care about what you can prove in a lab. So even though I was ahead based upon deduction, it wouldn't have been claimed to be valid based upon the scientific reasoning. So just to help to understand why that's the case, and why I do understand why these changes are happening as they do. Plus, Anthony Fauci's reason why he told people not to wear masks in the beginning infuriated me horribly. I mean, that's, to me, was an absolutely infuriating. It's just as infuriating as de Blasio with allowing the protests to go on, saying it's a very important thing. I think it's very disingenuous to treat people by lying to them and to give them misinformation or to protect something else. Whether it's your political career or whether it's your ideological system, to put people's lives in danger because of your ideology is scary to me. And that's what Dr. Fauci admittedly did when he said that he didn't want a run on masks, said he wanted to protect the hospital workers. So I told the people they didn't need masks, and it wasn't necessary at that point. I think it was a horrible thing to tell people.
So when masks are bad, now masks are good. Protests are bad with anti-lockdown protests. Now protests are good. And this woke virus spares you so long as you're kneeling for George Floyd.
Now, of course, Ben Shapiro here is being facetious when he says this, but this is the problem when it becomes political. And actually, in the Facebook chat that we had, this actually came up with Sheila talking about how she was upset specifically about this issue. And actually, she's absolutely 100% correct. Nobody cares about whether or not you're doing it for a right reason or a bad reason. When you put yourself at risk, you're putting yourself at risk. And the politicians have determined, because they are godlike people, and they get to determine what it is and how, who should be able to put themselves into risk at what level because of what they agree or disagree with. This is where we get into problems. This goes back to my video about selective enforcement. And when you create this, it creates that inequality, and people get angry and then do more foolish things.
I mean, think how bananas that is.
It's crazy. It's utterly nuts. I mean, that was mind-bogglingly incredible.
De Blasio this week said that, in effect, you are allowed to protest because racism is so systemic and profoundly evil that somehow it supersedes the deadly virus.
It's a woke
but
virus,
everyone
man.
else, a couple Orthodox Jews playing in a park in Brooklyn, we got a problem.
It's a seriously woke virus. I mean, good for Colin Kaepernick, who should win the Nobel Peace Prize as well as the Nobel Prize in biology, because kneeling, it turns out, actually cures coronavirus, which is pretty awesome.
That's
when you think about it.
incredible.
But it's, I think that there have been a bunch of false binaries that have been set up, and those false binaries are things like it's either total lockdown or total openness. It annoys me when people on the right treat mask wearing as though it's like a virtue signal. And
I 100% agree with Ben Shapiro on this, that when somebody on the right treats a mask as somehow they are losing something, it's like somebody saying, I am not going to get an antibiotic when I have strep throat because I don't want to give in to the system. And that's not healthy. We have to recognize this.
it annoys me on the left when people treat mask wearing as though it's an incredible virtue signal. You're an evil, evil person if you're not wearing a mask when you go to sleep at night, and you're a better person if you wear a mask. And on the right, there are people for sure who are like, well, I'm not wearing a mask under any circumstance. It's a violation of my freedoms and all this kind of stuff. Like, look, just when you're in a populated area with a lot of other people, wear a mask. It isn't that bad. Like, you should do it because you don't want other people to get sick. It's like that's the best we can do at this point in time.
Now, thank God here that Ben Shapiro actually puts this correctly. The reason why you're wearing that mask is not to protect yourself, it's to protect others. And again, I reiterated this in the other video. It's a very important point because you want to be accurate when you're telling people what they're doing and why they're doing it. The purpose of the mask is for others, not for you. And yes, you don't need to wear a mask when you're going to sleep at night in your bedroom. On the other hand, when you're out in public, you're putting people at risk if you don't.
With that said, the idea that we're going to full-scale lock down the entire American economy, or that we are going to leave children out of school for the next year because of COVID, like that seems patently insane to me. I mean, the reason it seems patently insane is because the data are pretty murky on a lot of issues. They're absolutely not murky on the risk to children. There is so little risk to children. If you're under the age of 20, you have a better chance of dying from the flu than you do of COVID. I mean, that's just a straight stat.
And that's also true. That for children, the danger from dying from COVID is not the issue. But what Ben does not address, and this is the part that we still don't know, is what happens when the kids go back to school, and are they going to become the spreaders? That's the question that we still don't really have an answer to.
And what that means is that maybe we can come up with some creative solutions where parents actually have a place where their kids can go for schooling. So my friend John Podhoretz over at Commentary Magazine, I thought he had a good idea. He said, why don't you keep the schools open, and then you have a bunch of 20-year-old proctors, and then you have the teachers Zoom in. Why doesn't the teacher have to Zoom to all the kids at home, right? Why don't you just do it at school, right? That seems like a fairly decent idea. But the incentive structure is created for politicians to lock down, because the more sternly you treat the virus, the better the media are going to treat you.
Right, the more virtuous you are.
Right, exactly. And this is how you see Andrew Cuomo, who was a garbage heap of a governor during this whole time, and who now creates magical posters, tributes to himself, with literally a curve that represents the number of dead bodies in his state, right, being treated as though he was great at this, when his death rate is like 8 or 9 times that of Florida, where Ron DeSantis is the font of all evil, and Greg Abbott in Texas, it's like 11 or 12 times the death rate in Texas. Like, none of the media coverage makes sense. The media, there are a bunch of issues here. The politics of it makes no sense. The media coverage of it makes some sense, but it's a really ugly sense because the politics have overwhelmed the data. And then on a data level, there's just a lot we actually don't know at this point.
Thank God that Ben Shapiro actually says exactly correctly that there's a lot we still don't know. And the point is that the nature of this should not be political. This should not be a right and left issue. This is like saying, we want to win a war. No, we want to lose the war. I mean, it really shouldn't be an issue about, well, why are we rooting against us to lose a war? Because that's what we're doing by not following what the facts are. And you're putting yourself, your family, your friends at risk if you do the wrong things. I don't want to see more people die. I want to see less people die. I am with Jen in the idea of stating that I want to see people do the right thing. And we have to be able to see what those right things are. And it's not so clear. The idea of putting these kids into school and then having proctors come in at 20 years old, maybe it's an idea. I mean, again, I think it should be tried and see what happens in a study situation, so you could see what the effect would be on when they go home, and then they bring things home, and does it get to the parents, and God forbid to the grandparents, and then we're going to see a lot more deaths that way. I don't think the case in Arizona where the 3 teachers went in and they did their washing, the social distancing, the masks, obviously something went wrong, and they all got COVID, and one of them died. And this is a horrible situation, and we don't want to see that on a mass level. On the same token, I do appreciate the people that say, we want to get back to a regular life, and we need to, and our kids need to be able to learn. I do appreciate the arguments. And I'm not saying you're an evil person for wanting it, but you have to keep your mind open to be able to hear other points of view and understand different points of view, because you're really talking about life and death. Saying I don't want to hear anything because of it is problematic. Saying I'm on this side and I don't want to hear anything else is a big issue. And this is one of the things that have gone on in our political system, where nobody could talk to anybody anymore. People can't hear another point of view. You're either with me or you're against me. And this is not healthy. And again, it's going to lead to a lot of people to die. I hope that you found this helpful. And Jen, I hope that you like this response. I hope that you'll hit like. I hope that you'll share this. I hope you'll subscribe if you haven't. And of course, if you'd like to become patrons to this channel, go to the Subscribe-star link below. I wish you a good night and good mental health. And please, stay safe from this virus. And if any time you have to be in public, put on the mask to protect others. And hopefully others will put on their mask to protect you.